Hey everyone, and welcome. So today we're going to talk about something that's a huge part of childbirth for so many people, but it's often kind of shrouded in mystery, or even a little bit of fear. We're talking about perineal tears, and our goal here is pretty simple. Let's swap out that anxiety for some good, clear information. The thing is, tearing during delivery happens all the time. It's incredibly common, but for some reason, it's just not something we talk about openly. So today, we're going to pull back the curtain, get a real understanding of what it is, and see how it's managed. So let's get right down to it. What exactly is a perineal tear? Well, it's basically a tear in the perineum. That's the spot, the skin and muscle, right between the vaginal opening and the anus. It can happen during that final pushing stage of labor, right as the baby is being born. It's really just a natural consequence of the amazing amount of stretching the body has to do. Okay, so here's our game plan. We're going to start with the basics of what a tear is. Then we'll look at why they happen. After that, we'll get into the really important part, the 4 different degrees of tearing. And finally, we'll cover how they're repaired and, maybe most importantly, what you can do to help with prevention and long-term care. All right, so first things first. To really get a handle on how these tears are classified, we need a super quick look at the anatomy. Because it's not just a single layer of skin. The perineum has a bunch of different layers, and that's the key to understanding everything else. So check this out. It's a surprisingly complex little area. You've got the outer skin, of course. Then there's the vaginal lining, or mucosa. Under that, you have a couple of different layers of muscle. And then, deeper still, you get to the anal sphincter and even the lining of the rectum. The severity of a tear is all about how many of these layers are involved. So that naturally leads to the big question, right? Why do these tears even happen? Well, it's usually not just one single thing. It's more of a combination of factors. Some related to the mom, some to the baby, and some to how the delivery itself unfolds. Let's kind of break this down into 3 buckets. On the maternal side, if it's your first baby, that's a big factor, just because those tissues haven't stretched before. When it comes to the baby, a larger than average baby, or even just the baby's position as they come out can play a role. And then there are obstetric factors, like if labor is moving really, really fast, or if instruments like forceps are needed to help with the delivery. All right, now we're getting to the real heart of it. The idea of degrees of tearing might sound a little intimidating, but trust me, it's actually a super clear and logical system. And once you understand it, the whole topic feels so much less mysterious. Let's just walk through this together, step by step. A first-degree tear? That's the most minor one, just the skin and the vaginal lining. Sometimes it's so small, it doesn't even need stitches. Now, a second-degree tear goes a little deeper and includes the perineal muscles. This one is by far the most common type. Things get a bit more serious with a third-degree tear, because that extends into the anal sphincter muscle. And a fourth-degree tear is the most extensive. It goes through all of those layers and into the lining of the rectum. And this is so important to remember. I really want this point to land. Even though we talk about 4 different degrees, the vast majority of tears are second degree. And what does that mean? It means that even though muscle is involved and you'll need stitches, that really critical anal sphincter muscle is totally fine. That's a huge relief for most people. Okay, you've probably heard the term episiotomy thrown around, right? So what's the difference between that and a tear? Well, it's pretty simple. A tear is spontaneous. It's something that just happens naturally. An episiotomy, on the other hand, is an intentional surgical cut that a doctor or a midwife makes. One is an uncontrolled event. The other is a controlled procedure. Totally different things. All right, we've talked a lot about what a tear is. Now, let's talk about the fix. Because for every single type of tear, there are well-established methodical procedures to repair it and make sure you heal up as well as possible.
So, for that super common second-degree tear, here's how it goes. First up, they make sure you can't feel a thing. The area is completely numbed. Then the doctor or midwife carefully repairs everything, one layer at a time. They'll stitch the inside vaginal lining first, then they bring the muscles back together, and finally, they close the skin on the outside with stitches that just dissolve on their own. It's a really precise process.
Now, what about those more complex third and fourth degree tears? Well, that's when the A-team comes in. The repair is always done by a senior, really experienced doctor, and it's usually done in an operating room. This just ensures they have the perfect conditions to meticulously repair every single layer for the best possible healing. Okay, this is where we get to the really good stuff, the part where you can take some control. Let's talk about what you can actually do, both before and after birth, to help reduce the risk and have a smoother recovery. So can you actually prevent tears? Well, It's not a 100% guarantee, but you can for sure lower the risk. During pregnancy, things like perineal massage and doing your pelvic floor exercises, your Kegels, can really help make those tissues more flexible. And then during labor itself, things like controlled pushing, having your midwife apply warm compresses, and just being in the hands of a skilled birth attendant can all make a huge difference. And what about after the baby arrives? Recovery is all about a few key things. For the first day or so, ice packs are your best friend for pain and swelling. After that, warm soaks or sitz baths feel amazing. And simple stuff like just keeping the area clean, using a stool softener so you don't have to strain, and then gently getting back to your pelvic floor exercises. It all works together to help you heal. So, when you put it all together, what's the big takeaway here? It's this. Yeah, perineal tears are a very real part of childbirth, but that's not the end of the story. The message is actually overwhelmingly positive. When a tear is identified correctly, repaired by an expert, and you take good care of yourself afterward, the chances of healing completely and getting back to normal are excellent. So I'll just leave you with this last thought to chew on. By having these honest, real conversations about what childbirth is actually like, we take away the fear and replace it with power. Knowing what could happen doesn't make it scarier. It actually makes you so much better prepared to face your own journey with confidence. Thanks so much for joining us.